If a woman comes in the first part of her cycle, we can do a transvaginal ultrasound. We can measure the ovaries. Ovaries should normally measure about 2 by 3 centimeters, 20 by 30 millimeters. And we can also perform something called an antral follicle count. Antral follicles are the small follicles in the ovary in the first part of the cycle that contain immature eggs. And by counting those number of antral follicles in each ovary, we can determine from a structural standpoint, an ultrasound standpoint, if a woman has normal ovarian reserve or diminished ovarian reserve. The other way that we can assess ovarian reserve is to ask a woman to go in on the 3rd day of her menstrual cycle and get her blood drawn. We look specifically for 3 hormones involved in reproduction. We look at FSH, follicle stimulating hormone. We look at estradiol, which is the estrogen made by the ovaries as the follicles get bigger. And we look at another hormone called AMH, which stands for antimüllerian hormone. When we get the results of those 3 tests back, we can put them into sort of an algorithm, and we can determine if a woman's ovarian reserve, i.e. the number of eggs that she has left, is normal or diminished for her age. The question that always arises is who should be tested, and when should they be tested, and how often should they be tested? And there's really no right answer for this. There's no consensus. At Texas Fertility Center and at Ovation, what we tend to recommend is that all women who are 35 years of age or older who are not yet ready to pursue childbearing should really consider getting their ovarian reserve assessed annually.